Hello, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
5. Today it's 5, Brad, not 7.
5, yes.
5 easy 30-second mid-back stretches to release pain and tension. We're going to try to keep this video a little bit shorter this time.
Right, and you know, we have a, yeah. See how
I
long
do
that,
laugh.
We're going to show, you know, we show a lot of things on little tools you can use, things you have laying around the house or you might purchase. This is all if you're at work or anywhere, and it's all stretches. You don't need anything for it. They're very short, and they can be very effective.
Yeah, sounds good, Brad.
But Bob, wait.
Oh, yes. If you are new to our channel, please take this opportunity to subscribe to us. We provide videos on stay healthy, fit, pain-free. We upload every day. Also, Brad's learning his job here. Please go over to Facebook and like us, because Brad and I, as children, were not liked, and we're trying to turn things around. As you can see, it's Bob and Brad. That's where you go to find us.
On the Facebook.
On the Facebook.
Okay.
All right. Do you want me to do number 1,
Yeah,
Brad?
do number 1, Bob.
All right. Number 1 is the Cat Camel. We never know which one is which.
We get corrected, and I tell you, some people
There's
say
different...
one thing and others say another. So I'm not going to say one way or another what it is, but we're going to show you what it is.
So generally, you know, you're making a hollow in your back, and then you're making a hunch in your back. But I like to move the neck along with it.
Sure.
So when I do the hunch, I used to bring my head up like this.
So we're getting the complete range of motion of the spine.
And when I'm hunching this way, I bring my head down. I'm glad we're doing these this morning, Brad, because I was a little tight in this area.
Yeah, I believe you were tight this morning. One thing that I want to emphasize is breathing with this. So make sure that you're relaxed breathing. Breathe in through your nose, out through your mouth. And that goes for all these exercises. It'll make your stretch much more effective. Yeah,
because you're moving your rib cage, which is the part that's giving you trouble here. You know,
sure.
It's attached to the mid back. Right. So the breathing is extra important on this particular exercise. All right, Brad's going to show number 2.
Now this one you can do standing, but I think it's a little bit better seated because you're a little more relaxed and you got your pelvis stabilized. But you put one arm here and here and give yourself a big hug, and then you just hug and squeeze, and you can do this and then squeeze and round the back out and then shoulders forward, and you can feel those muscles right across between the shoulder blades stretch out. Okay. Take a deep breath in here and then exhale and relax as you stretch out. And this is the only time I want to see you have posture like this is when you're doing a stretch, because this becomes a bad posture, but we're only doing it strictly briefly for the stretch.
Gotcha.
Okay, next one. Oh, I
so
like
now
this
we're going to go
one.
in the other direction.
Well, actually, we're going to go side stretches. We want to cover all the planes. We're doing forwards, flexion, extension, now lateral movements as far as the therapist train of thought. One hand here, and do this. I'll do it from this angle. We're going to get the shoulders back, chest out, good posture. Take a deep breath in, and as you exhale, we're going to stretch to one side and relax.
Ooh, that does feel good.
Oh, yeah. And then take a deep breath in, and then exhale and relax. Stretch it out.
Yeah, this is the one I normally do, so this is good.
Oh, one more time just because it feels good. Yes. And
yeah, it's stretching different things.
The breathing makes an incredible difference. Breathe properly. Relax everything. I always tell my patients, allow yourself to stretch. Don't force it, because that's how you can be relaxed and be more effective. Next one.
Next one, Brad.
I can't remember it.
You're laying flat on your back.
I'm just kidding. Now this you can do in a bed. Works good on a nice carpeted floor. You can go on a hard floor. It's just not quite as comfortable. And this one you're going to get, I'm 5'10", I'm going to imagine I'm going to get 9 foot tall, taller than Bob even. And I'm going to reach up here, and I'm just going to stretch up with my fingers, and my feet and toes are going to go the opposite direction. Take a deep breath in, and stretch, and exhale, and feel your body lengthen, lengthen, lengthen. You're going to feel your spine stretch apart.
Are you bringing your hands, try to bring them toward the floor too at the same time or not?
Right. It depends on your shoulders, because we're not stretching shoulders. But yeah, you're going to keep them here. But you know, my shoulders are tight.
You're thinking of pushing them that way.
Yeah.
Yeah. Okay. Toward the wall.
Yeah, we're trying to get longer.
Lengthened. Okay. Gotcha.
Deep breath and exhale, and do that 3 times. And each time you'll get an inch longer. You stand up. It's good for basketball players before a game.
All right. Yeah, there you go. Yeah, get a little more height and get a little more.
And you're ready to go.
That's right.
Okay.
Why don't you show your pretzel one, and I'm going to show it a different way, Brad.
An option.
Okay.
This one, we talked about forward, backwards, and right and left. This one does rotation. So we're coming at the thoracic spine from a little different direction.
Now with this one, it really is important to have good posture on this, Brad, because you could hurt your back if you didn't.
Yeah, you know, I learned this one before as a therapist when I was in karate. And we always did this one, and it was always great for my back. I always cavitated with it. So you take this one across here, and this one you're only going to do as well as all these. They should feel good, like a good stretch. There should be no pain.
But look at how straight he's keeping his back. That's what I want you to note.
And
he's not bending his back.
With all these, you know, don't be too aggressive. It should feel like a good stretch.
Gentle, gentle.
And here we go.
Now he's going the other way.
And stretch, nice and relaxed.
So I'm going to show you an alternative to that. If that one scares you a little bit, instead, and I do this with golf too. I mean, you can do it with a pole, but we said no equipment, so I'm going to do no equipment, Brad.
Sure.
So you're just going to go ahead like this. You're going to get in really good posture again. You're going to grab your fist with the palm on the other side, and you're just going to gently rotate back and forth. And if you find out that you have one side that's painful and one side that's not, I want you to go to the pain-free side. So let's say
pain-free.
So this side hurts. Oh, that hurts. So I'm going to go to the pain-free side. Am I actually going to give it a little shove?
Kind of little push.
A little rotation, a little over-rotation. And then I'm going to go back here. Does that feel better? Great. Maybe I'll do a few more of those.
Sure.
A little overpressure.
So you work the pain-free side with the intent that the
other
side is going to loosen up as a result of it.
And if both sides are fine, you might give a little overstretch either way then.
Right, sure.
So. All right, Brad, you know what? We did it in 7 minutes.
Yeah, boy, this is a miracle.
Yeah.
So one way or another, this is just another way it's working at fixing that.
Yeah, if you can't, you know, we can fix just about anything except for
that broken heart.
Yeah, but we're working on it
That's right.
diligently.